Preeclampsia is a dangerous physiological condition that could result in serious complications both for the mother and the fetus. Preeclampsia is defined by the association of a hypertension higher than 140/90 at two different registrations and a proteinuria, an abnormally high level of proteins in the urine set at higher than 0.3 grams excreted in 24 hours. According to the World Health Organization, WHO, the incidence of preeclampsia ranges between 2% and 10% of pregnancies worldwide. In Malaysia, the prevalence of hypertension in pregnancy among respondents aged 15 to 49 years was 6.5%, that reported in National Health and Morbidity Survey, NHMS, Maternal and Child Health 2022, which increased from 5.8% in 2016. About 1.8 to 16.7% of the incidents are reported in developing countries, while in developed countries, the rate is 0.4%.
Risk factors of preeclampsia. Firstly, history of preeclampsia. Women who have had preeclampsia in a previous pregnancy are at an increased risk in subsequent pregnancies. Next risk factor is first pregnancy. Women pregnant for the first time are at higher risk. Multiple pregnancy. Women carrying twins, triplets, or more. Multiples put more stress on the body, especially the placenta. Certain health conditions. Chronic conditions such as diabetes, high blood pressure, and kidney disease. Woman at 35 years old or more. Occurrence of changes in the uterine structure and birth canal is not flexible anymore. There are nutrient recommendations to reduce the risk of preeclampsia in pregnant women by reducing blood pressure and inflammation, as well as assisting with weight maintenance. Dietary fiber. Pregnant women should eat a high-fiber diet such as fruit and vegetables. To lower the risk of preeclampsia, they should consume 25 to 30 grams of fiber every day. Calcium. Pregnant women are advised to take calcium supplements, which is more than 1,000 milligrams per day. Taking 500 milligrams of calcium every day for more than 6 months of pregnancy has demonstrated a 45% decrease in the likelihood of preeclampsia. Nevertheless, taking 500 milligrams of calcium every day before the 20th week of pregnancy doesn't notably lower the risk of preeclampsia among women with a history of prior preeclampsia or eclampsia. Thus, every expectant mother should receive a daily 1-gram calcium supplement starting from the 20th week of pregnancy until childbirth. Those at increased risk of preeclampsia or with insufficient calcium intake in their diet should consider taking a calcium supplement ranging from 1 to 2 grams per day throughout their pregnancy to lower the risk. Vitamin D. It is necessary to treat vitamin D insufficiency before pregnancy. Pregnant women often need vitamin D supplementation to reach the recommended levels, suggesting a daily intake of 10 to 25 microgram, which is 400 to 1000 IU, to avoid deficiency. This measure may lower the risk of preeclampsia. Due to individual differences in vitamin D levels and how the body responds to supplements, screening could help determine the best dosage for each person. Milk-based probiotics. Probiotic foods contain living strains of bacteria that help to balance the gut microbiota and have been linked to lower cholesterol and blood pressure. The consumption of milk-based probiotics such as yogurt and kefir, particularly during the later stages of pregnancy, showed a protective link against the risk of preeclampsia, including severe cases. These are suggestions to prevent preeclampsia. First is drinking 6 to 8 glasses of water daily for good hydration. Next is by avoiding fried foods and junk food that are not beneficial to mother and child. Mothers also need to use little salt or no added salt in their meals to avoid high blood pressure, which can harm both mother and child. Other than that, mothers also need to have a good rest and not be in a stressful condition daily, as this can affect mother and child. Exercise regularly can also decrease the risk of having preeclampsia. Mothers can do simple exercises such as yoga or swimming frequently. During pregnancy, mothers should avoid beverages containing caffeine, as caffeine can disturb the absorption of most medicines. Next is by taking supplementation such as calcium supplementation as recommended by their doctors. The conclusion is that to prevent preeclampsia, pregnant mothers need to take good care of their diet and exercise regularly according to the doctor's instructions.